Today we are talking about newborn care, and we hope that you are joining us with questions and comments while you snuggle on a rainy Friday morning with your little one. And without further ado, we have Dr. Godoy here to talk to us about all that good stuff. Alrighty, thank you so much. Thank you. Okay. Yes.
I think I'm here. Hi, good morning, everyone. Like Danielle said, I'm Dr. Godoy. I'm a general pediatrician here at the Montville outpatient location. It's a general practice. So, newborn care. I thought I will talk about a few of the most common questions that I get when I have new mothers here in the clinic, especially first-time moms. So to start off, I think, the first visit, the question I get most is about feeding. So is the baby feeding enough? How much? How do we know that we're giving enough milk and breastfeeding? How do we know if I have, if the breast milk is coming in and so forth? So I think what we normally say is that we want the babies to feed at least, every 2 to 3 hours. But just so that you know, a lot of babies are going to feed more often. They might feed every hour in the beginning, or they might, cluster feed and feed many times for a few hours and then take a little bit of a longer break. So there's not like a set time that you need to follow, throughout the day. And I think that's important to know, to be a little bit flexible and follow the baby's cues and so forth. It's normal that the baby lose a little bit of weight after they're born. We normally have like a 10% of the birth weight threshold. We start getting a little bit nervous when they're down at the 10%. And we might push a little bit more to feed and make sure to feed like even overnight, every 2 to 3 hours and so forth. We want them to have regained their birth weight by 2 weeks of age. So they have a little bit of time. So with that said, in the beginning, when the milk is not come in yet, if you're breastfeeding, they might be like small, drops. It might not be that much that the baby's getting in the beginning, but that might be enough. And so don't feel too stressed, and, we can give it a few days. I have this on my ID a lot of times because this is the size of the stomach, more or less, in the beginning. So it's, they shouldn't have to drink 2 ounces. Some babies do, but it's like, this is not a big, stomach to fill. So it's probably more often feeds than large feeds in the beginning. With formula, yes, they usually stay a little bit full, a little bit longer, and we know a little bit easier how much they're getting, or if you're giving breast milk through the bottle. But the biggest thing that we monitor is wet diapers. So if the baby's peeing, we know the baby is not, dehydrated and is getting enough to pee. And also, of course, here in the clinic, we can check their weight. And if the baby is starting to gain weight, we know that the baby is getting, fed. So with that said, sometimes we talk about also wet diapers and dirty diapers when they're born. So a rule of thumb is that if we say the first week of life, normally we want as many wet diapers as the baby is days old. So if the baby is 4 days old, we're expecting more or less 4 wet diapers that day. If the baby has more, that's great. That means that the baby is feeding really well. But that's, a rule of thumb. And it's usually, so you count it for 24 hours. Then after a week, maybe the baby's going to have 12 wet diapers, but at least like 6, 7, that's what we want it's a good sign that the baby is fed and that the baby is not dehydrated. With the poop, we don't have the same rule. So that's something also that parents worry about. But so in the beginning, the poop is, the meconium, the first poop we monitor, and we really want that, so that's dark and tarry. And then little by little, it's going to transition to that yellow, seedy, if it's breastfed, or pasty poop when they are more formula fed. And a breastfed baby can poop once a week, once every 2 weeks, and it can be perfectly normal. Or they poop with every feed, and that can also be perfectly normal. So that's a variety that you're going to learn what's normal for your baby, sort of. But we don't really focus so much about that. It's more the wet diapers for like hydration status than it is for anything else. The poop, of course, if it's hard pebbles and it looks like the baby's straining or blood or anything else, then that's something that you would bring up to your doctor, and that's more important to talk about. But if the baby's, pooping normal, loose, yellow, seedy poop, but even if it's once a week, then that can be normal for that baby. So I think that's something parents ask a lot about. What else do we talk about? Sleep. The baby sleeps a lot in the beginning, and in the beginning it's different stretches and maybe sleeping more during the day than they're doing at night, and little by little the baby's going to transition into more of our day and night routine. And we always try to take the chance when the baby's sleeping to also get some rest, because a lot of times they have the witching hours at night, probably the time when you're the most tired and you feel like you need to go to bed and sleep. And sometimes that's when the baby is not settling down and not as happy. So try to take the chance to sleep when the baby sleeps, and then little by little the baby's going to get into a better sleep routine. So that's usually, but they might sleep 19 hours and in the first few weeks of life, so they sleep a lot, and that's normal. But you want them to feed, and you want them to have all these wet diapers to know that that's okay. What else do we talk about newborn care? A lot of times parents ask about the skin. The babies can have a little bit cracked skin and dry skin in the beginning. I usually just say use Vaseline on the skin to make sure that it's not dry. Vaseline doesn't have a lot of ingredients that you react to, so usually that's very gentle for the skin. Sometimes the baby can have acne and more like bumps in the face and so forth. Maybe not use the Vaseline in the face then, but that's usually more bothersome for the parents than it is for the baby itself. They don't know of it. And the umbilical cord, it should get dry and it should fall off. Usually we say about the 2 weeks of age, the umbilical stump falls off. I normally tell parents to put the diaper under the area so it doesn't like pull on it. But you just leave that be. You don't have to do anything with it. You don't have to clean it. But if there's redness around the umbilical stump, or if there's discharge that looks like pus or anything, then that would be definitely something to contact the doctor to get evaluated. What else? A lot of parents ask about supplements when the baby is born, if they need anything. And the breast milk has a lot of benefits, and it has a lot of immunoprotection for the baby. So of course we are promoting that as much as possible. One thing that the breast milk doesn't have enough is vitamin D. So that's usually the only thing. If it's an otherwise, full-term baby and healthy baby, it's usually only vitamin D that we recommend to supplement with. And even if the mother is taking vitamin D supplements, because most of us are also a little bit deficient, it's not shown to go over in the breast milk enough. So babies should have vitamin D drops from the first week of life. You should start with that. And that's actually also for formula. So like purely formula fed babies, they're getting vitamin D from the formula, but it's not until they're drinking 32 ounces a day that they're getting the full dose that they need daily. So all babies should have vitamin D drops in the beginning. And that's the only thing. And what else do you ask about? Did I have split up what diapers, dirty diapers?
I have a question.
Yes.
Or I had a question. Oh, okay. Let me pop in here.
So what do you honestly think about if baby's like first night sleeping through the night and you wake up to nurse, would you truly wake baby up to feed baby if it's been like 3 hours? What are our thoughts on waking baby?
So and this is actually a very common question too, and I talk about that a lot. So normally, if it's the first few days of life, the baby's still losing weight or the baby is not regaining the birth weight, then I might be a little bit more like, don't go above 3 hours. or maybe maximum 4 hours. It depends on like how nervous we are about the weight. So then I say, yes, wake up. But it's not sometimes, it's a suck-in reflex for the baby. So sometimes you can actually feed a baby sleeping.
Okay.
So if you, up in the upper, in the palate of the baby. So if you're breastfeeding, it's sometimes a little bit harder. But with the bottle, like you should be able to almost so there's a reflex and they feed almost sleeping.
That's awesome.
But
awesome for them, not
also
us.
for them. Yes. If I see a baby, we have a few, visits and the baby's growing beautifully, and that's the curve, like the curve looks beautiful, then I'm never going to tell you to wake up a baby. So then I'll be like, then it might be you want to go and pump because you feel like you're full and that it's leaking or anything else. But I would let the baby sleep as much as possible if they're growing beautifully.
Awesome.
And that's actually something, because a lot of parents ask, what should the weight be, or like how much, is this a normal weight, and and it's all about the growth curve. So it's a big span on what's normal. So we're comparing the baby to the baby's self, and what's like normal for baby girls at this age, if they're full term, what's a normal, average. So I never say like this is the number that she needs to be, or it's more like that they're following the curve and that they're not falling off the curve too much. So that's a big thing.
What about, I'm just thinking of questions. So first of all, is it weird that I have toddlers, they're older, and when you mentioned that like yellow mustardy poop, I was like, oh, I miss that poop. Because gross. So you'll miss that poop one day, moms. But what about passies? I was always so crazy about not giving a pacifier. And then I read that it actually, there's research against SIDS and passies and things like that. So can you talk a little bit about passies?
Yes. And that was actually part of it. I should have spoken about. So pacifiers, we don't recommend it like the first week of life. So if there's any issues with like latching and establishing this breastfeeding routine, so it's more like when you've established that the baby has a good latch, the baby's feeding well, and there's like no issue that in that regard, then pacifiers, you can use them however you want. And it is shown now to be actually protective. We don't really know for sure, but we think that it's sort of like a micro arousal at night, so they're not so deep asleep, and that can prevent them from SIDS. So pacifiers at night, yes, definitely. And safe sleep is another thing, and that I didn't say. So safe sleep, basically, they recommend babies to be in the parents' room at least 6 months. They say preferably up, the full first year, but in the parents' room, in a crib or a bassinet, appropriate for age and size of the baby. Fur mattress, no blankets and stuffed animals or pillows or anything that they can get wrapped up in, or that they could sort of suffocate from. And with that said too, with the safe sleep, the pacifier is protective, and also you want to, in the beginning, it might be a good idea to swaddle, because it sort of suppresses all these newborn reflexes that can like wake them up by itself. But that's not like, you don't have to swaddle. If you feel like your baby's sleeping perfectly without swaddling, that's fine. But if you have more of a troubled sleeper, maybe that's helpful in the beginning. But when they start rolling over and so forth, then that could be more dangerous to swaddle, and then you should stop swaddling. But in the newborn period, when it's so small, that a lot of times the swaddling is helpful. Yes, that's a good thing.
Well, sleep was always, my kids didn't sleep, so I was like desperate for that. I was nursing all night long.
Yeah. And that's hard. And that's also one of the things, like there's no such thing as safe co-sleeping. I see sometimes on threads or on posts about, well, we're doing safe co-sleeping, but there's not really such a thing. So really try, and it's really hard because we're tired at night and we're breastfeeding and the baby falls asleep when you're feeding and you sofa, but really try to put them back in their bed and do that, because it's terrifying otherwise, and it can be so fast.
Yep, absolutely.
Yeah.
Awesome.